My name is Dr. Katherine Langan. I'm the Antimicrobial Stewardship ID physician at Western Health, and I'm really pleased to be able to present today on behalf of my co-authors electronic medical records, dosing calculators for Gentamicin and Vancomycin in adult non-critically ill patients. I also would like to thank the National Centre for Antimicrobial Stewardship for this opportunity. I'm recording this on the lands of the Wurundjeri people, and I wish to acknowledge them as traditional owners. I would also like to pay my respects to their elders past and present, and Aboriginal elders of the other communities who may be listening to this recording. These are the affiliations of myself and my co-authors. We have no conflicts of interest to declare. Gentamicin and Vancomycin have narrow therapeutic windows. They require individualization of dosing to minimize adverse effects and to achieve pharmacokinetic and pharmacodynamic targets. Initial dosing is based on weight and proportionally adjusted renal function. The Australian Therapeutic Guidelines provides dosing recommendations for both gentamicin and vancomycin. However, a pre-implementation audit of prescribing of these antibiotics at Western Health demonstrated frequent guideline divergence, resulting in both under and overdosing. Therefore, to facilitate appropriate empirical dosing, the Western Health Antimicrobial Stewardship Service designed dosing calculators for vancomycin and gentamicin for non-critically ill adult patients. These are initially designed as standalone Excel-based calculators. This is an example of the user interface for the gentamicin calculator, and this is the vancomycin calculator. In 2019, after the adoption of standard EMR, these Excel calculators were hyperlinked to their respective EMR orders. In 2020, they were then used as a prototype for the design and validation of fully integrated EMR dosing calculators. This is how the EMR vancomycin order set appears at Western Health. The vancomycin dosing calculator is launched from within this order set by right-clicking on it and selecting Modify. This opens a Powerform calculator. As different dosing may be required for the critically ill, those receiving renal replacement therapy, and for surgical prophylaxis purposes, the prescriber is advised to not use the calculator for these indications. 5 patient parameters are required: gender, age, height, weight, and creatinine. I will now go through some examples to show you how the vancomycin dosing calculator works. Patient JC had MRSA bacteremia. She was a young female of average height and weight and with good renal function. Her most recent weight and height auto-populated as they were both recorded in the EMR. And the most recent creatinine, if available, is visible in the results panel. A loading dose of 25 milligrams per kilogram, rounded to the nearest 250 milligrams, is calculated using actual body weight for those between 40 and 120 kilograms. This is capped at 2.5 grams. For patients with a weight below or above this range, the prescriber is advised to consult AMS for infectious diseases. It should be noted that, once again, this calculator is not used in critically ill patients, in which a loading dose of 30 milligrams per kilogram is recommended. The initial maintenance dose is based on the therapeutic guideline algorithm, which combines actual body weight and creatinine clearance. Our Western Health algorithm is similar to this, but has narrower, more numerous categories. When the total calculated daily dose is greater than 5 grams, prescribers are also directed to consult AMS or infectious diseases. as a continuous infusion is usually required. For those with a creatinine clearance greater than 21 mils per minute, as we see for Miss JC, the dosing frequency is either 8-hourly, 12-hourly, or 24-hourly. A minimum of 500 milligrams and a maximum of 2 grams is given at each dosing interval. The calculator also gives guidance about therapeutic drug monitoring. At Western Health, we use trough levels in lieu of AUC over MIC to guide ongoing dosing. The calculator has recommended a trough level prior to the 4th dose, as her dosing frequency is 12-hourly. For those who have a 24-hourly dosing, a level prior to the 3rd dose is recommended. And for those with a creatinine clearance less than 21 mils per minute, daily spot levels are recommended. This leads on to our next patient example, Mrs. C.A., who has Enterococcus faecium bacteremia. She is an elderly female of average height and weight, but with significantly impaired renal function. As she has a creatinine clearance less than 20 mils per minute, an initial maintenance dose of 15 milligrams per kilogram is used, and the frequency is then to be guided by 24-hourly spot levels. I will next move on to the gentamicin dosing calculator. This is the gentamicin EMR order set, and as before, the calculator is launched from within the order set. Contraindications to using both gentamicin and the calculator are listed at the top in red. I will give you now an example of Mr. E.K., who presented with urosepsis. He is a middle-aged man of average height, but increased weight, and a relatively normal renal function. As his actual body weight is more than 20% greater than his ideal body weight, then adjusted body weight is used to calculate his dose. Dosing is 5 milligrams per kilogram, rounded to the nearest 40 milligrams. The maximum dose is 480 milligrams. The initial dosing interval is based on creatinine clearance, as per the Australian Therapeutic Guidelines recommendations. As this gentleman has a creatinine clearance greater than 60 mils per minute, 24-hourly dosing is recommended, with 3 doses in total. For those with impaired renal function with a creatinine clearance of 40 to 60 mils per minute, 36-hourly dosing is recommended, with only 2 doses in total. For those with a creatinine clearance of 30 to 40 mils per minute, 1 dose only is recommended. Alternative therapy is recommended for those with a creatinine clearance of less than 30 mils per minute, and the calculator will not give any dosing recommendations for those patients. Our progress to date is that the validation process has been completed, and we go live in late October 2020. So by the time you hear this recording, a pre-implementation audit has taken place, and a post-implementation audit will commence once we go live. This will include appropriateness of dosing, trough level timing, achievement of therapeutic trough levels, and a prescriber feedback. EMR integration calculators for other AV antimicrobials requiring weight-based dosing are also planned, and that for trimethoprim sulfamethoxazole is currently being built, and the algorithms have been developed for a range of other antimicrobials. I would like to now acknowledge the work of Pauline Megallaa, the Western Health Antimicrobial Stewardship pharmacist, and that of Nang Ha, Chong, Dr. Stephen Guy, and Andrew Chong, who developed the Excel calculators. The Western Health EMR team, particularly Bryan, Yeoh, who integrated these Excel calculators into the EMR. And finally, the Western Health Antimicrobial Stewardship Working Group. Both myself and Pauline Megallaa would very much enjoy discussing any other aspects of the calculators. And here are our email addresses, mobile phone numbers, and Twitter accounts. Thank you. Enjoy Antibiotic Awareness Week.